I chose to become a nurse 17 years ago because I wanted to make a difference. I wanted to help people and see if there was something that I can do that would impact somebody in what happens in their life. As an ICU nurse, I loved the intensive care portion of that. I love the critical thinking. But I felt like I could do more. I felt like so much of the work that I was doing was really just focused on just a small portion of someone's life, either during a critical illness or unfortunately sometimes the very end of their life. So the reason I chose to go back to school and become a nurse practitioner was just to really take that next step and be able to make maybe even more of an impact and work with that person more before they were so ill or before they ended up in the hospital. My approach to patient care has always been to listen. They know themselves better than anyone else. They know the journey that they're on, and they know the goals that they want to reach. So my focus at the Corvallis Clinic in Neurology is going to be stroke care. That is my first love and my passion. And I would love to be able to work with patients and their families who have been affected by stroke in the community. So patients that would potentially see me would be those who have had a recent stroke, that have just been discharged from the hospital, patients who have had a stroke or a transient ischemic attack, who have been cared for or worked up by their primary care provider and would just like another set of eyes. I'm very fortunate that in this practice, I work with an amazing group of neurologists. So there's continual collaboration with patients, patient care. Any concerns that I have, I've got the experts right at my fingertips. And it's a great environment for me, for our patients, for the community, to have this partnership here in neurology to be able to care for these patients. I have a fantastic family. I've been married for 25 years. I have 2 teenage daughters who are so much fun. Between sports and music, we're a pretty busy family, but in the off season, we love to travel, we love to go on vacations, be outside as much as we can. And every summer for the last number of years, I have been the nurse out at Girl Scout camp. And I do that along with my daughters who are camp counselors. So it's just a fantastic week. We're all in the woods, no distraction, everybody's getting dirty, and we're watching 150 little girls in the woods just rocking it and just being strong and powerful and feeling independent. And that to me is so much fun. And when I'm not doing that, I love to read. I always have a book in my pocket. I hope that when patients come to see me, they feel a little more empowered, a little more educated. They feel that they've been listened to and that they have a plan moving forward. My goal is to educate through the process, whether it's a new diagnosis or a new illness, and just always keep in mind that the patient is not a diagnosis that they're given. They're an individual. That's really what I'm looking to do, is partner with them to achieve the goals that they want to achieve so they can live the life that they want and do the things that bring them joy.